this affect almost all adults by the time they reach 75. Meaning by the time we hit that age, nearly all of us will have some type of cataract.
Advancements in cataract surgery, including intraocular lens implants, allow many people to have their sight fully restored. I recently sat down with John Berdahl at Vance Thompson Vision to find out more about the options they offer at one of the nation's most experienced clinics in vision correction. Dr. Berdahl, thanks for sitting down with me today.
Great to be here.
So we all hear a lot about LASIK and PRK as options for vision correction, but is there another option for people that maybe that's not the best option?
You know, actually there's lots of options, and we can almost always find a way to correct your vision. Of course, you got glasses, contacts, LASIK that everybody's heard of, PRK, which is very similar. There's SMILE, which is also kind of similar, and those are all surgeries we do on the cornea. But there's also an approach called an ICL, which stands for implantable contact lens. And it's also known as a phakic IOL. And so you might hear us slip into that jargon because the word phakic means that you have your natural lens. So what happens is when light comes in, it goes through the cornea, the front part of your eye, and the lens in your eye, and those two focus light onto your retina. And if light isn't focused on the retina, then we need to do something different. We need to put another lens in the system, either your glasses, the contact lens that sits on your cornea, or a contact lens inside your eye, or change the shape of the cornea. So an implantable contact lens is a lens that goes in front of your natural lens inside your eye and is kind of a permanent fix for your vision until you would develop a cataract later in life.
What kind of patients would this be the best option for?
Yeah, so the phakic IOL or ICL is a good option for a lot of patients. We use it mostly in patients that are very nearsighted. So maybe they're too nearsighted for LASIK or PRK because we'd have to thin the cornea more than we'd like to. Occasionally there's other reasons we would do it if somebody's got really bad dry eye, but it's usually for those people that are very nearsighted.
We know with LASIK, it is a really quick recovery. It's done before you even realize it started. How is this surgery similar or different from that?
Yeah, great. A couple of changes with this. One, we're going inside the eye. So we do that in an operating room as opposed to a LASIK suite. The other thing is we do one eye at a time. It's not unreasonable to do both eyes at the same time, but we almost always do just one eye at a time, usually a day apart. So you'd come in and have your right eye done and then your left eye done. One of the things that I love about the ICL is that these are probably my single happiest patients because they were so nearsighted they couldn't even see like right here. And then you put this lens in and they come out of the operating room and they look across the room and they can see immediately. So patients love this. Now, I would say that there's a little bit more risk than LASIK. LASIK is one of the safest procedures in all of medicine and one of the most successful procedures in all of medicine, but we are going inside the eye. And so that gives a little bit of a risk of infection, a little bit of risk of increased eye pressure or glaucoma, or an increased risk of cataract. So we always talk about these things, make sure that we're all on the same page and make sure we can decrease those risks as much as possible.
So you mentioned nearsightedness, but can this also be a correction for farsightedness?
Yeah, so it's really not a correction for farsightedness with one notable exception. There is something that you can get called a compassionate use, and you can import these lenses from outside of the United States for people that are farsighted. We probably do that once every couple of years for a very extraordinary situation, but the vast majority of the time we're using it for people that are nearsighted.
Now, Vance Thompson Vision is always a leader in terms of research and development of products, and so how has that impacted this?
Yeah, we are. We're almost always involved in the clinical trials that help get these technologies approved. In fact, right now we're in a clinical trial for an ICL where if you're very nearsighted, you can get it and you can actually get it for free if you qualify. And that'll be for a limited amount of time until the study's fully enrolled. But if you were ever told that you maybe were too nearsighted for LASIK, phakic IOLs can be an option, these ICLs, and there may actually even be a way to get it free right now.
That seems really impressive. One of the things I've always been really impressed with too at Vance Thompson is how you are able to take so many different specialties and different procedures and kind of make this like ultimately the best possible vision you could ever have. And so you're saying this is permanent until maybe I have a cataract. Is there anything else that, you know, this is really like goes along with, or would you do this in any other kind of surgery, like combined with anything?
Recently, they approved these implantable contact lenses that can also fix astigmatism. Prior to that, sometimes we would do the ICL and then do LASIK over the top to get rid of the astigmatism because we didn't have to thin the cornea as much. But usually this is a standalone helps. And it really comes down to what we believe. We believe that we shouldn't just get good at one procedure. We believe that we should be good at the procedure that's best for you.
So when I'm trying to make this decision on what I need to do to fix my vision, what kind of questions should I be asking about my eyesight to figure out what I need to do?
First of all, the question you just asked me is a great one. Just ask your doctor, what question should I be asking? Okay, so that's a great start. I think the best question you can ever ask your doctor is, what would you do if it was your eyes? Because that takes into account all of the evidence and their experience and their comfort level and what makes sense, and helps codify that into a personalized plan for you. You know, the other things that you can ask more specifically are, what is the risk? What is the upside? How many of these have you done? Those are all really good questions for you to get comfortable that the approach you're taking is the best one for you, for how you're going to see for a really long time.
When you get up from LASIK, you can immediately like see farther than you could before. Is it the same with the ICL surgery?
Same thing with the ICL. Just keep in mind that you usually only have one eye at a time. So you see amazing out of one eye, and then you do the other one, and you're like, oh my gosh.
I can't wait for tomorrow.
Can't wait for tomorrow.
Thank you so much for taking time to sit down and explain that ICL surgery. It sounds like a great option for people that can't have LASIK especially.
Super fun as always.
Thank you.
You will be greeted with excellence from the moment you walk in the door at Vance Thompson Vision. If you'd like to schedule a consultation with any one of the vision experts at Vance Thompson Vision to talk about which vision correction surgery is the best option for you, give them a call in Sioux Falls at 605-361-EYES or 3937. You can also find out more by visiting VanceThompsonVision.com.